The Cases tab is where most of the data entry and data processing of the patient exists. This particular window is broken up into two parts, and we'll judge it by the top and the bottom. The top part is where you enter in the different admission records for your patients. The bottom part is where you're going to enter in any status records, OASIS, and plan of care information. To be able to enter in any plan of care, OASIS, or any kind of status records, there needs to be an admission that it is linked to. As you can see, when you come to the Cases tab, the only button that I can click on is the New button. To enter in a new admission for the patient, click on New. The admission record is broken up by 6 different tabs that contain information as given to you by your referral source. The admission form contains information such as the start of care date, the date that the plan was established, the date that the patient was last seen by a doctor or when they were last hospitalized, who the referral came from, and who the current physician is. You also have a field to choose the case administrator and the admission source. You can also enter in any kind of historical diagnosis code information as well as assign particular caregivers to this field. The Emergency tab allows you to enter in any kind of emergency contact information, who the responsible party is, who the primary and secondary contact are, and any disaster plan that you may have. The Assessment Supplies History tab, as well as the Orders, Directives, Equipments, and Medications tab allow you to enter in any kind of historical information about the patient as given to you from your referral source. The entry of data in these fields are optional. However, we will print out a report later on that shows its usefulness. I'm going to go ahead and enter in some information. The Orders, Directives, and Equipments tab also has an Acuity Level field that appears here on the bottom of this particular screen. The Acuity Level field allows you to be able to create a custom coding system for your patient's acuity. This particular acuity system is something that your agency develops and categorizes your patients by. Some agencies use a numbering system where a patient as a number 1 may not be as severe as a patient as number 5. Also, some agencies use different kind of color coding systems such as red, blue, or green as being okay. You feel free to type in whatever you would like in these acuity level fields. I'm going to go ahead and enter in number 3 because my patient on a 1 to 5 scale, 3 is pretty severe but not so severe. The Medications tab allows you to enter in any kind of historical medication information. The System Information tab details when the patient was referred on and when this particular admission was created and by who. It also shows you your patient's current status. When creating an admission record, although there are many different fields for you to be able to populate information, the only required information necessary for saving an admission record is a case administrator, the admission source, and the referred on date. When you're done, click on Save. One important thing to note about the admission: should the patient become discharged and then readmitted to the agency at a later point in time, it is not advised for you to go and create a new patient record. Instead, the proper workflow is to open up the patient record, go to the Cases tab, and add in the new admission. We're going to do that with this patient over here named Jack Bowers. As you can see with Jack Bowers, he is currently discharged from the agency, but we want to go ahead and readmit them. So I'm going to go ahead and open up the patient record. I'm going to go to the Cases tab. And what I'm going to do is just add a new admission right under the previous one. So just go ahead and click on New. And you want to follow the steps as mentioned previously. Enter all historical information as given to you by the referral source. Make sure you enter in the case administrator. Make sure you enter in the admission source. And last but not least, make sure you enter in the system information, the referred on date. Once you're done, go ahead and click on Save, and you will have yourself a new admission. If I was to click on it, and then from here you can go and continue further with your additional status records and everything else that pertains to this new admission.